Hi, I'm Ken Schultz, a licensed sales agent from Humana. Understanding Medicare and all your options can be overwhelming. We hope to make it a little simpler for you by providing an overview of Humana's HMO health plan and how it may help protect you from high out-of-pocket healthcare costs. We're very proud to say that we're one of the largest administrators of Medicare Advantage plans in the country. More than 6.6 million Medicare beneficiaries have chosen Humana to be their healthcare partner. And it is a partnership because at Humana, healthcare is more than just paying your bills when you're sick. Our goal is to help our members achieve lifelong well-being. And the Medicare Advantage plan you choose can be a big part of that. When choosing a health plan, it's important to understand all the options available to you so you can feel comfortable with your decision. Today, we hope to help you understand how a Medicare Advantage plan works, what you need to do to join, and what this Humana plan has to offer. Before we begin, you should know that there are specific time periods when you can enroll in, disenroll from, or change your Medicare plan. These periods generally fall between October 15th and December 7th. During the rest of the year, you may qualify for a special election period if certain special circumstances apply to you. Your agent can provide the details to you, but now is the time you'll want to explore coverage options available to you for 2015. So, what are your Medicare options? There are several ways to receive your Medicare coverage. Option 1 is Original Medicare. If you go that route, you may need to enroll in a separate Medicare Part D prescription drug plan, often called a standalone PDP, because Original Medicare doesn't cover prescription drugs. Option 2 is Original Medicare plus a Medicare supplement policy plus a prescription drug plan. Many people who select Original Medicare purchase a Medicare supplement plan, also known as a Medigap policy. They do this to reduce their financial liability. If they need drug coverage, they may add a PDP too. And option 3, that's Medicare Advantage. You can choose to get your Medicare coverage through Medicare Advantage. These are often called MA plans. With many Medicare Advantage plans, you'll have a health plan and drug coverage, and you won't need a Medicare supplement plan. One plan, one company, simple. We're going to talk in more detail about option 3, Medicare Advantage. So, what are Medicare Advantage health plans? The federal government's Centers for Medicare and Medicaid Services, CMS, refers to Medicare Advantage plans as Medicare Part C. Private insurance companies approved by Medicare provide this coverage. Most have lower out-of-pocket costs than Original Medicare. Medicare Advantage plans must offer all the benefits of Original Medicare. Medicare Advantage plans that also include Part D prescription drug coverage are called MAPD plans. Many Medicare Advantage plans offer extra benefits as well, and there's usually less claims paperwork to file. Medicare Advantage plans are not Medicare supplement plans. Medicare supplement plans are purchased in addition to Original Medicare. Medicare Advantage plans offer all the benefits of Original Medicare and more in one simple package. And remember, when you enroll in a Medicare Advantage plan, you still have Medicare. You don't lose it. You're just choosing to take the Medicare Advantage version of Medicare, which is administered by a private company rather than the federal government. And here's something for your peace of mind. Medicare Advantage plans are reviewed and approved annually by CMS. By approving a plan, they're saying that the benefits in total are at least as good as Original Medicare benefits. You don't have to worry about being surprised by extra costs later. Humana's HMO plan is approved by CMS. As you learn more about all this plan has to offer, you may question how Humana can offer so much at such an affordable cost. When you join Humana, CMS will pay us a flat monthly amount while you're a member of our Medicare Advantage plan. The money is sent to us whether you have claims or not. When you have claims for using plan benefits, the claims come to Humana, and Humana is responsible for paying them. There are many options for your Medicare benefits, so how do you select the best plan for you? Start by thinking about the following questions to determine what you need from your Medicare plan. What type of plan do you currently have? What do you like about your coverage? What would you add to your current coverage to make it ideal for you? And does anyone help you make decisions about your health care, and should they be present? The answers to these questions may leave you feeling much more confident about making your enrollment decision. Now, let's talk about the specific plan we're discussing today, Humana's HMO plan. With an HMO, you'll choose your healthcare providers from an established network of doctors, specialists, hospitals, and other medical service providers. These providers have agreed to accept a discounted rate from Humana, and we pass those savings on to you. Now, there are a few exceptions. You may see a non-network provider or receive non-network services if the visit is approved by your primary care physician and the plan first. And if you need urgent or emergency care while you're away and a network provider isn't available, go to the closest emergency care center. With most HMO plans, you'll need referrals from your doctor for specialist visits. Check with your sales agent on whether the HMO plan in your area requires referrals from your doctor. The advantage to an HMO plan is your out-of-pocket cost may be significantly lower. Our provider networks are large, but even if your current doctor is not in our network, the plan may bring you such value that it's worth changing your primary care physician, your PCP. Simply select a new PCP from our provider directory, and if you're not completely happy with your choice, you can change your PCP monthly until you find one who can be a true healthcare partner to you. It's important to know that if an HMO plan does not cover prescription drugs, CMS does not allow you to combine a prescription drug plan with it. Ask your sales agent if the plan he or she reviews with you has prescription drug coverage. For a plan with prescription drug coverage, it's important to review the formulary or drug list, which is the list of specific medicines covered by the plan. Talk with your agent about the specific drugs this plan covers. You can also look up your prescription drugs and their cost on our website at humana.com. Even if you see your medicines listed, in some cases, Humana may require you to try certain drugs first to treat your condition before we'll cover a more expensive drug. This is called step therapy. You may have heard of the Medicare prescription drug coverage gap, or donut hole as it's sometimes called. The coverage gap is the period when you have to pay part of your drug costs before additional Medicare coverage kicks in. This year, once you enter the coverage gap, you'll receive discounts on your prescription drugs. You'll be responsible for paying no more than 65% of the cost of many generics and no more than 45% of the cost of many brand name drugs. People with Medicare who receive a low-income subsidy or are enrolled in an employer-sponsored retiree drug plan, with the exception of employer groups with waivers, won't be eligible for this discount. And not all brand name drugs may be covered. The manufacturers must agree with CMS's terms and conditions to contract with Medicare. If you're covered by both Medicare and Medicaid, you may be eligible for another type of Medicare Advantage plan with prescription drug coverage. You should contact your state Medicaid agency and your doctor to determine if a special needs plan is a good option for you. You may also be able to get extra help to pay your prescription drug premiums and costs. To see if you qualify for extra help, you can contact Medicare, the Social Security Administration, or your state Medicaid office at the numbers shown here. We've covered a lot of information today, and you may have some questions. Your first resource is the Humana licensed sales agent who's presenting your specific plan benefits today. Another great resource is the Medicare and You Handbook, which you should receive in the mail from CMS. You can also go to www.medicare.gov, the official Medicare website, which contains helpful information about Medicare benefits and prescription drug plans. Another helpful resource is your local state health insurance program. So, what are the next steps? Right now, your Humana licensed sales agent will review two very important documents. The Summary of Benefits, which covers many of the specific features of Humana's HMO plan, and the formulary, or list of drugs covered by this plan. If you're interested in enrolling today, your agent can also help you fill out an application. Once you become a Humana member, you'll receive your Humana member ID card in the mail. You'll also receive a health assessment call and will ask you to complete a health questionnaire. This will allow us to see if you qualify for any special health programs. I also encourage you to attend a member orientation, which will help you use your plan and extra services to their full advantage. Finally, and perhaps most importantly, you can call us, your partner in health, anytime you have questions. Feel free to use this time with your agent to learn more about what Humana has to offer. For Humana, I'm Ken Schultz.